The Cancer Coalition of South Georgia came about because of the overwhelming cancer problem in the region. And there was an opportunity for the stakeholders to come together, and these are entities that typically competed in the areas of cancer control and cancer care and cancer prevention, but they realized that they could have a greater impact by working together than any single organization or institution could do.
So the coalition was formed as a neutral body that could bring these organizations together, who would coordinate all of the planning, who would be able to evaluate any of the programs that we were involved in, to look at the data to figure out where the greatest pockets of needs were so that we could apply our limited resources in those areas first. They needed an organization to coordinate all of those things, but one that would be trusted by all 4 of the participating hospitals.
The vision of the collaborators was to see if we couldn't combine our resources to, first of all, educate the region about the need for screening and prevention, and then work diligently to connect them with services that were available.
The mission is accomplished by arranging and maintaining the partnerships that are required to address the serious cancer needs of the area.
Well, like other areas of Georgia and probably other rural areas around the country where primary care is lacking, we see huge, high incidence of death. I knew that it was very, very important to start a screening program, and I reached out to Diane and her group because I knew that they would do it better than I ever could.
A key reason that the clinical providers believe in this program and support it and provide hundreds of thousands of dollars of in-kind services is because they know that it is cost effective.
We started understanding that we needed a navigator to work out of the community health centers and the primary care clinics very early on in the pilot project back in 2007. And the reason for that is that we knew we needed someone who paid attention every day to those patients who were coming to the clinic to determine whether they needed any type of screening.
We pick up by helping the patient understand what's expected of them, and we help them break the barriers if there are any. And when I mean barriers, things like transportation needs or language translation, fear. That's a major one that we encounter, is patients are afraid to have a procedure, especially if it's their first time. And the way we do that is by providing education, giving them information about what's expected, and that helps the patient to feel more comfortable about having the screening done.
For us and for our physician group, having the partnership with the Cancer Coalition and having their staff help educate, prepare, identify the patients that really need to be selected for these types of services was key.
What they do is our nurse managers actually know who these women are, and so the health navigators reach out to them, and then they come into the various health departments and get their screenings and get their mammograms scheduled through us. I just know anecdotally that it works for a lot of women, because that's very stressful for a woman to know that they can't have their mammogram because they don't have the insurance, and the program is on, diversion because it's run out of funds.
That's our primary mission is correct training and developing excellent family physicians to continue to deliver primary care to the people that need it out in rural Georgia. We have the Cancer Coalition actually come in during their orientation, give them an orientation. Some of those residents become quite interested in doing some of the projects and working with it. We have increased the number of screenings that we've been able to do due to the assistance of the coalition, and which is really great, because people need this, and if they can't afford it, if they don't have the insurance, that they just don't get it done.
And I became involved in the Cancer Coalition a number of years ago when I was still a Deputy Director of Public Health. We realized the need for additional cancer screening and a lot of the projects that there were just no resources for. So when we had the opportunity to have a navigator come to Early County, help with the outreach, also then with the tracking after the procedure, but the most important role was helping that patient navigate the process.
The navigator is able to do a little bit more than what we can do in the facility because they have that time to actually call the patient, see what the problem is, actually help them identify some of those dynamics to get them back in.
You know, we have many examples of screenings that we know have saved lives. So not only are we improving the outcome of patients, improving their quality of life long term, but also in a way that's going to save the healthcare system dollars that we need to put into additional screenings.
I've been impressed that we've been able to make a difference here in a part of the country where some people might think access may not be as robust as others, and what we really found out is our collaboration here leads the way from a lot of places that have far more resources than we do. So far it's been exciting to see that like the scales that oftentimes we see in life, a single grain of rice can oftentimes tip the balance. You know, we don't have a lot of grains of rice, but we're trying to tip the balance in the right direction.
It's such a rewarding thing to be a part of a collaborative effort like this because, you know, when you put your head on your pillow at night, you know that you've helped prevent a cancer or helped to identify one early, that patient has been saved suffering and pain and possibly death. It's a good feeling. I'm glad to be a part of it.